Welcome to our comprehensive guide on Zyprexa, where we demystify this medication and shed light on its uses, side effects, and alternatives. Whether you're a healthcare professional or an individual seeking information, you've come to the right place. Uses of Zyprexa in mental health treatment. Zyprexa, also known by its generic name olanzapine, is primarily prescribed to individuals diagnosed with schizophrenia and bipolar disorder. It belongs to a class of medications called atypical antipsychotics, which work by restoring the balance of certain chemicals in the brain. Zyprexa is effective in reducing hallucinations, delusions, and abnormal thinking associated with these conditions. However, Zyprexa is not limited to these specific uses alone. It may also be prescribed off-label for other mental health conditions, such as severe depression, anxiety disorders, and borderline personality disorder. Off-label use refers to the use of a medication for a purpose not approved by the FDA. While off-label use is legal and common, it is important to discuss its appropriateness with your healthcare provider. Despite its effectiveness, Zyprexa should not be considered a cure for mental health conditions. It is a tool used to manage symptoms and improve quality of life. It is typically prescribed as part of a comprehensive treatment plan that may include therapy, lifestyle changes, and other medications. Common side effects of Zyprexa. As with any medication, Zyprexa comes with a list of potential side effects. It is important to note that not everyone experiences these side effects, and the severity can vary from person to person. Common side effects of Zyprexa include weight gain. Zyprexa is known to cause weight gain in some individuals. This can be a concern, especially for those already struggling with weight management. Drowsiness. Zyprexa may cause drowsiness or sedation, making it important to avoid activities that require alertness, such as driving or operating heavy machinery. Dry mouth. A common side effect of Zyprexa is dry mouth, which can lead to discomfort and an increased risk of dental issues. Staying hydrated and practicing good oral hygiene can help alleviate this symptom. Constipation. Zyprexa can slow down bowel movements, leading to constipation. Increasing fiber intake and staying hydrated can help prevent this side effect. Increased appetite. Zyprexa may increase appetite, leading to overeating and weight gain. Monitoring food intake and making healthy choices can help manage this side effect. While these side effects are generally mild and manageable, it is important to discuss any concerns with your healthcare provider. They can offer guidance on how to minimize these effects or explore alternative treatment options. Rare but serious side effects of Zyprexa. While rare, there are some serious side effects associated with Zyprexa that require immediate medical attention. These include neuroleptic malignant syndrome, NMS. NMS is a rare but potentially life-threatening condition characterized by high fever, muscle stiffness, confusion, and changes in blood pressure and heart rate. If you experience these symptoms while taking Zyprexa, seek immediate medical help. Tardive dyskinesia, TD. TD is a condition characterized by involuntary movements, such as lip smacking, grimacing, or repetitive movements of the limbs. It is more common in long-term Zyprexa use and may be irreversible in some cases. High blood sugar and diabetes. Zyprexa can increase blood sugar levels, leading to a higher risk of developing diabetes. Regular monitoring of blood sugar levels is important, especially for individuals with pre-existing diabetes or those at risk. Hyperlipidemia. Zyprexa may increase lipid levels in the blood, including cholesterol and triglycerides. Regular monitoring and lifestyle modifications may be necessary to manage this side effect. It is essential to be aware of these rare but serious side effects and report any unusual symptoms to your healthcare provider promptly. Alternatives to Zyprexa for mental health treatment. While Zyprexa has proven efficacy in managing certain mental health conditions, it is important to explore alternative treatment options as well. Not every individual will respond to Zyprexa in the same way, and some may experience intolerable side effects. Additionally, Zyprexa may not be the first-line treatment for every mental health condition. Some alternative treatment options to consider include other atypical antipsychotics. There are several other atypical antipsychotics available that may be prescribed as alternatives to Zyprexa. These include medications such as Risperdal, Risperidone, Seroquel, quetiapine, and Abilify, aripiprazole. Each medication has its own unique profile of side effects and efficacy, so discussing the options with your doctor is crucial. Psychotherapy. Therapy, such as cognitive behavioral therapy, CBT, or dialectical behavior therapy, DBT, can be effective in managing symptoms of various mental health conditions. It may be used alone or in conjunction with medication. Lifestyle modifications. Adopting a healthy lifestyle can have a positive impact on mental health. Regular exercise, a balanced diet, adequate sleep, and stress management techniques can all contribute to overall well-being. Other medications. Depending on the specific mental health condition, there may be other medications available that can be used as alternatives to Zyprexa. For example, mood stabilizers such as lithium may be prescribed for bipolar disorder, while selective serotonin reuptake inhibitors, SSRIs, may be used for depression and anxiety disorders. It is important to remember that finding the right treatment plan often involves trial and error. Working closely with your healthcare provider and being open about your experiences and concerns can help guide the decision-making process. How to talk to your doctor about Zyprexa. When discussing Zyprexa with your doctor, it is essential to have open and honest communication. Here are some tips to help guide the conversation. Prepare for the appointment. Before your appointment, make a list of all the questions and concerns you have about Zyprexa. This will ensure that you cover all the necessary information during your visit. Describe your symptoms. Be specific about the symptoms you are experiencing and how they are impacting your daily life. This will help your doctor understand your needs better. Discuss your treatment goals. Clearly communicate your treatment goals to your doctor. This can include managing specific symptoms, improving overall functioning, or minimizing side effects. Ask about alternatives. Inquire about alternative treatment options to Zyprexa and their potential benefits and risks. This will allow you to make an informed decision about your treatment plan. Address concerns about side effects. If you have concerns about specific side effects associated with Zyprexa, express them to your doctor. They can provide information on how to manage or minimize these effects. Remember, your doctor is there to work with you and find the best treatment plan for your specific needs. Open and honest communication is key to achieving this goal. Tips for managing side effects while taking Zyprexa. If you decide to take Zyprexa, there are strategies you can employ to manage potential side effects. Here are some tips. Monitor your weight. Regularly weigh yourself and keep track of any changes. If you notice significant weight gain, discuss it with your healthcare provider. They may recommend dietary changes or alternative medications. Stay hydrated. To combat dry mouth and potential constipation, make sure to drink plenty of water throughout the day. Sipping water or using sugar-free lozenges can also help alleviate dry mouth. Practice good oral hygiene. Maintaining good oral hygiene, such as brushing and flossing regularly, can help prevent dental issues associated with dry mouth. Follow a balanced diet. Be mindful of your food choices and aim for a balanced diet. Incorporate fruits, vegetables, whole grains, and lean proteins into your meals. Avoid excessive consumption of sugary or high-calorie foods. Stay active. Engaging in regular physical activity can help manage weight gain and improve overall well-being. Find activities you enjoy and make them a part of your routine. Attend regular checkups. Regularly monitoring your blood sugar, lipid levels, and other relevant parameters can help detect any potential issues early on. Attend all scheduled appointments and follow the recommendations of your healthcare provider. By implementing these tips and maintaining open communication with your healthcare provider, you can minimize the impact of side effects and optimize your experience with Zyprexa. Long-term effects of Zyprexa use. The long-term effects of Zyprexa use are an area of ongoing research and debate. While Zyprexa has proven efficacy in managing symptoms of mental health conditions, there are concerns about its potential long-term effects on physical health. One of the most significant concerns is the risk of metabolic syndrome, a cluster of conditions that increase the risk of heart disease, stroke, and diabetes. Long-term Zyprexa use has been associated with weight gain, increased blood sugar levels, elevated cholesterol and triglyceride levels, and high blood pressure. It is important to note that not everyone who takes Zyprexa will experience these long-term effects. The risk varies from person to person and is influenced by factors such as age, genetics, lifestyle, and pre-existing medical conditions. Regular monitoring of metabolic parameters, such as weight, blood sugar levels, and lipid profiles, is crucial for individuals taking Zyprexa long-term. Lifestyle modifications, such as adopting a healthy diet and engaging in regular physical activity, can also help mitigate the risk of these long-term effects. If you have concerns about the long-term effects of Zyprexa, discuss them with your healthcare provider. They can provide guidance on monitoring and managing these risks based on your individual circumstances. Legal issues and controversies surrounding Zyprexa. Zyprexa has been the subject of legal issues and controversies over the years. In 2009, Eli Lilly, the pharmaceutical company that developed Zyprexa, agreed to pay a settlement of $1.4 billion to resolve allegations related to the off-label marketing of the drug. The company was accused of promoting Zyprexa for uses not approved by the FDA, including the treatment of dementia in elderly patients. Additionally, there have been concerns raised about the transparency of clinical trial data and the potential for conflicts of interest in the research and marketing of Zyprexa. These controversies have sparked debates about the ethical practices of pharmaceutical companies and the regulation of the industry. It is important to stay informed about the legal issues and controversies surrounding medications like Zyprexa. Being aware of these matters can help you make more informed decisions about your treatment options and advocate for your own well-being. Conclusion: weighing the benefits and risks of Zyprexa. Zyprexa is a widely used antipsychotic medication that has proven efficacy in managing symptoms of mental health conditions such as schizophrenia and bipolar disorder. It can significantly improve the quality of life for individuals experiencing these conditions. However, it is essential to consider the potential side effects and long-term risks associated with Zyprexa. By discussing your treatment goals, concerns, and alternatives with your healthcare provider, you can make an informed decision about whether Zyprexa is the right medication for you. Regular monitoring of side effects and metabolic parameters is crucial to ensure your well-being while taking Zyprexa. Remember, mental health management is a journey, and finding the right treatment plan may require trial and error. By staying informed, advocating for yourself, and maintaining open communication with your healthcare provider, you can navigate the complexities of mental health care and make choices that align with your individual needs and goals. Demystifying Zyprexa is an important step towards empowering yourself with the knowledge and understanding necessary to make informed decisions about your mental health. Thanks for watching.